Welcome back to Health Tech Talk Live. I'm Ben Chodor, your host, and you're listening to WGST 640 on the iHeartRadio network globally, actually everywhere. So we're being broadcast everywhere. And with my guest right now is Robert Herzog, CEO of eCaring. Robert, welcome to the show. How are you doing today?
Fine, thanks very much.
Thanks for coming in. Your company has been in the news. You guys are really moving. But before we start, tell the audience a little about eCaring. How would you explain to the people at home listening to this show what eCaring is all about?
Well, in a nutshell, eCaring keeps people out of the hospital. And we do that because we invented an icon-based language that enables home aides, patients themselves, and caregivers to enter enormous amounts of real-time actionable information from the home. That information, whether it's mental or physical state, behavioral, clinical, medication adherence, is then transformed by algorithms to set up alerts and notifications so care managers can respond quickly to circumstances in the home and keep small problems in the home from becoming big ones leading to the hospital.
So let's drill this down a little bit. So sure. My parents are at home, they're older. How does this information get sent to my care manager?
Well, most of our patients are dual eligibles, Medicaid, Medicare recipients, or Medicare. And so they often don't have any internet connection in the home. So we provide a tablet and a cellular data plan for them. And then the home aide can use the tablet in the home using an eCaring system called Care Tracker to enter all this information. Once that information is entered, it's then uploaded into the cloud where anybody on the care team of your mom, your dad, your patient, the patient, can view the information in real time and then respond to it.
Right. So who's included in the care team? So am I considered part of my parents' care team, or is it just a physician?
No, you could certainly be considered part. I mean, family members can play a very important role. And what's nice about eCaring is with the system, you're carrying in your pocket, in your smartphone, the peace of mind that says, if a situation requires immediate attention, I'll know about it. But the care team itself is a care manager, can be the primary physician, of course, the home aides, family members, whomever the care management team designates.
And do most people like using it? I mean, has there been pushback? Because you think of that generation not wanting to. I don't actually believe that. I think that generation is, in some ways, really connected. But what's the feedback?
So you're an 82-year-old woman with diabetes.
Yep.
Your blood sugar drops to 70. Your normal response, particularly for low income, is to go to the emergency room. With eCaring, the aide enters 70, not necessarily even knowing if that's good or bad, but that triggers an alert for a blood sugar under 100. That triggers, in turn, a phone call from the care manager into that home, talking to the aide, talking to the patient, and saying, basically, look, we'll get you to the ER if we need to, because I know you're crashing and feeling anxious, but at the same time, drink a glass of orange juice. And a half an hour later, that blood sugar is 106, and we've avoided a terrible episode, a hospital visit, an ER visit, one of 6 of which leads to a hospitalization. So do the patients like it? Yes, because it keeps them at home.
Well, it's really fascinating because last week one of my guests was talking about it's called a company called Health Loop, and they were talking that the age 65 to 85, they almost care more about staying connected with their health than any other age bracket.
They want to stay at home.
Right.
They want to age in place, and they want to do it in comfort and dignity. But think about it. The home, up until us, frankly, has been primarily a black box from which no information came from regarding healthcare and healthcare data. So we're a new source of big healthcare data, eCaring is, that enables including data from the place where people spend most of their lives and where most of the serious events in their lives occur.
I'm Ben Chodor, and you're listening to Health Tech Talk, and with me is Robert Herzog, CEO eCaring, and you're listening to WGST 640 on the iHeartRadio network. And I want to send a special shout-out to 1-800-Public Relations for all the work that they've done on the show and getting guests and everything that they do for all their clients. Thank you. And so Robert, who are your customers? So who does eCaring go out and sell to? Are you selling to hospitals and payers? Are you selling to the individual families? Who's the customer?
What the impact that eCaring has is it reduces costs for the patient. So with the trial with dual eligibles, we saved over $500 per patient per month. With managed long-term care plan, we're saving, and this is over a year and a half, an average of around $300 per patient, per member per month. So our clients are people who are payers, or plans or agencies, particularly those that are exposed to Medicare risk. And we have a pretty broad array now.
So not only are you saving thousands of dollars a year for the plan, or in some cases even the family,
right,
but you're giving them better quality of care.
Much, because now you know immediately if somebody's, there's a trend. If somebody only slept 2 hours 3 nights ago, you know it right away. If somebody didn't take their medications, you know that right away. So we have an enormous database that we develop with these patients. So our clients include large insurance companies like Health First, that was the announcement you just saw, large payer systems and plans such as Metropolitan Jewish Health Systems, Senior Health Partners, Complete Care, others.
And the list goes on.
And the list goes on.
So it's just starting. So it's like a domino effect. You're getting one, and they're all starting to follow because they got to offer the same?
No, I would say it's because the changes in healthcare have demanded, in effect, that they start responding to these changes. You have the Affordable Care Act, which drives towards managed care, and then you have capitated rates so that you get a certain amount total for taking care of a dual-eligible patient. If you don't live within that ceiling, it will crash down on top of you. So we're now proving in repeated programs that we cut the costs. So I think what's driving it is our success.
Wow, that's great. How did you start the business? So where did it come from? Because your background, let's talk a little bit about your background. You're not a healthcare guy. You're not a doctor, right? You've started successful businesses before.
Yes.
How did eCaring come about?
I'm I guess a serial entrepreneur, sometimes to my mother's dismay, I would say. But nonetheless, what happened really, my background is primarily certainly digital media, both as an entrepreneur and as a creative person. I also, as you know, manage business affairs for City Winery, a great place in New York. But what happened, frankly, to me was what happens to so many other people. My mother, who worked till she was 79 years old in a law firm, one of the stars sort of the last century, retired finally, had a few good years, and then a few tough years. And those tough years were really hard. And what I saw, certainly personally, nobody's prepared logistically, economically, financially, and emotionally for that change. So, frankly, we went through that all. My mother passed away. And what I learned is that what you don't know can hurt you. And so then I thought, well, this is weird. I'm an entrepreneur, but, I learned all these lessons, and I'll never use them again. And then I saw other people going through the same thing. So I said, there's sort of the 60s compassionate side of me, if you like, which said we deserve better. And then there's the entrepreneurial side, said I think there's a real opportunity here to do good and, make a business out of that. That's really the origin.
And then, so you just started it. So you raised a little money and you went down the road.
Well, we bootstrapped for a while. I had a friend down and another partner early on, and we developed a system. But our first system really was oriented towards families taking care of family members. And it worked really well. The aides love it.
Right.
Even now, aides, we get 95+% satisfaction. It really empowers aides to be in the home and provide information. But about 3 years ago, we raised significant money in order to change tactics a little bit and focus on the enterprise market. So that's really, we built all of these care management tools to view the information, to filter it into alerts, to respond to it, to keep track of it. We have all kinds of analytics now. So as a care management organization, how long is it taking to respond to alerts, what are the outcomes by different care managers. So it's very detailed.
So Robert, how important are the analytics in everything that eCaring's doing?
Well, we probably, in a year with just, 30 patients in one program, we have over 100,000 data points. There's never been information generated from the home like that. So I think that the analytics are very important in assessing what are typical interventions and outcomes so that you can make determinations. That's also very important for reducing hospital readmissions, because all the readmission programs right now, essentially for risk stratification, say what happened to the patient before they got into the hospital and what happened to them during the hospital stay, what their condition is. But very few of them, or if any, can generate information when they leave the hospital. And
right,
that, of course, is the time you need to get it.
So to jump in here, just so our audience at home knows, everyone listening to Health Tech Talk on WGST 640 on the iHeartRadio network, what does readmissions mean? Does it hurt hospitals? I mean, why is it so important that you don't want me to come back into hospital? Besides, we don't want you to come back to the hospital.
So that's another one of the sea changes in healthcare in the last few years. Hospitals, frankly, when the patient left their doors, didn't think much about him until they came back in again. But several years ago, the Centers for Medicaid and Medicare Services introduced a program of penalties so that if hospitals had higher than average national rates for readmissions and certainly key conditions such as congestive heart failure, and other kinds of pneumonia, infarctions, etc., they'll be penalized for that, and the penalties get severe. So for a major urban hospital, they can be in the millions of dollars. So all of a sudden, hospitals have to start paying attention to what happens to the patient after they leave.
So besides giving them better quality of care, right, and better patient engagement, which is what it's all about, I actually, as an institution, can save money, or as a payer, save money, or get reimbursed differently.
You can avoid penalties, which is certainly saving money, and then you can get better closure on capping costs. I think it's really important to understand that the capitated rate systems, the value or performance-based payments, really change the nature of the game from fee-for-service. You're no longer just doing something and charging for it.
This is an incredible conversation. I can't wait till we come back. We're going to cut for a break. You're listening to Health Tech Talk on the WGST 640 on the iHeartRadio network. We're going to come back and we're going to talk more about the financial, and also give some tips for companies that want to start businesses.
This is a special notice to consumers who owe back taxes to the IRS. Due to the financial hardship consumers are facing during the decline in the U.S. economy, the Internal Revenue Service has made it easier to settle delinquent tax problems. In some cases, this may even result in back taxes being reduced. An open phone line has been established by National Tax Relief for consumers to call and see if they qualify. To ensure your financial stability during this decline in the economy, take down this number, 800-832-9615. That's 800-832-9615. If you owe back taxes to the IRS and can't afford to pay them back, there's no need to fear anymore. You may qualify for a program that could settle your delinquent tax problems and in some cases save you money. For your free information and to see if you qualify, call National Tax Relief at 800-832-9615. That's 800-832-9615. 800-832-9615.
We're having the biggest certified pre-owned sale ever this week only at Rick Hendrick Buick GMC. We're loaded with trade-ins, loaner cars, off-lease vehicles, and certified pre-owned vehicles. Now is the time to buy. Huge discounts, no money down, and no payments for 3 months on all certified pre-owned vehicles. You heard right, huge discounts, no money down, and no payments for 3 months on certified pre-owned vehicles this week only. For example, we have a 2013 Buick Verano, just $15,888. A similar 2015 Verano would cost $28,900. That's almost $13,000 in savings if you buy certified pre-owned. Check this out. A 2012 GMC Sierra Crew Cab, just $28,894. A new Sierra like this goes for $36,329. That's over $7,000 you save if you buy certified pre-owned. Call 855-SHOP-ATL or go to Rick Hendrick Buick GMC Atlanta.com.
Rick Hendrick ATL.
Ever have one of those days when the clutch in your brain goes out, your mouth won't work, and you cannot find a good attitude to save your life? Hi, this is Jeff Foxworthy. When I have a bad day, I try to remember those kids that I have visited who are fighting cancer. Their little bodies are weak from battling this dreaded disease and from surgeries and cancer treatments, but they're not sad or down. Incredibly, they have this great attitude that they're going to beat the tar out of this monster, childhood cancer. They believe they'll survive. In their courageous hearts, they believe we, the grown-ups, will do something about this monster. They believe and trust in us. If these kids have the heart to keep fighting and living, then the rest of us must have the heart to help them. Your donation to Cure Childhood Cancer will help fund the life-saving research for kids who are battling and believing. It'll make your day. Donate at curechildhoodcancer.org.
I'm Corporal Dina Span with the Duluth Police Department. Within the past 3 years, we've had 2 officers struck by passing motorists while working on the side of the road. Both officers sustained serious injuries as a result of a motorist failing to move over. If you see an emergency vehicle with flashing blue, red, or amber lights, move over 1 lane from the emergency vehicle. If you're unable to change lanes, slow your speed to under the speed limit and be prepared to stop. Help make our roads safer for everyone by moving over. Remember, it's the law.
Move over, Georgia. Save a life.
Bloomberg. The First Word with Kent Pruitt. Monday morning at 5 on Talk Radio 640 WGST.
Welcome back to Health Tech Talk. I'm Ben Chodor, your host, and you're listening to WGST 640 on the iHeartRadio network globally. And with me is Robert Herzog, CEO of eCaring. And in our first segment with Robert, we were talking about his business, how he created the business, how it's helping, people stay at home, getting well and growing old in their home instead of being moved into institutions. And it's about staying connected, and it's about connected health, because we're on Health Tech Talk and we should be talking about, the connected home. But I first want to jump in is, money, right? So everyone's interested in money. So we talked a little bit about how we save money for institutions, and we save money for the families. How does eCaring make money?
Well, we charge a subscription rate. It's very simple. Per member per month, we charge. We sort of separate it out in a sense. We provide the hardware, the tablet and connectivity, and then mobile device management for that, so we can remotely control it. And then we charge for our software. And it's basically a simple, straightforward subscription rate.
Right. And so based on our first part of our conversation when we were talking, you can save $2,000, $3,000, $4,000 a year, if not more, on a patient. It sort of pays for itself.
We're averaging a 400% return on investment. So using the eCaring system for a plan will give them 4 times what they spend on us back. Wow. At a minimum.
Wow. So now let me just segue a little bit out of eCaring, but Robert Herzog, entrepreneur. So we have a lot of people listening who want to start businesses, who want to get into the space of health tech. What's some things they should be thinking about? How do you go about raising money? How do you go about building a business plan? And is there room in this market for new innovations in health tech?
Well, when I started this and I told people I was bringing digital media into healthcare, I was kind of laughed out of the room. It was so alien to people, and that was not many years ago. So now you have, frankly, you have a healthcare startup on most corners in New York, an enormous amount. And not all of them will succeed, but some will. I think that the ones that do will have defined their mission really well, and it could be a big mission or a small mission. Some of them are just trying to make referrals better for a physician's practice. Some of them are trying to do big things with regard to using technology in hospitals. But I think you really need to do your research as to what's out there, because I've seen people who propose things, and I mentor some, and I say, have you looked at this? And they go, oh, no, I hadn't thought of that. So you really need to know what your market is, what else is out there, and how you can position yourself. And then I think, I didn't do it because I've been an entrepreneur for a long time, but I do think that some of the accelerator programs are helpful in that they get you probably the toughest thing to get, and that's your reference client, your first clients. So if you can get a mentor, if you have the other relationships, fine. But it really helps in healthcare to have, a credible partner, a credible client who you can point to and say, talk to them about us because we do good.
I agree, because we're both pretty active in Blueprint Health, which is a New York-based accelerator that they have a couple classes a year where companies get to raise money, and they get to they introduce them to investors, they introduce them to potential clients. They don't teach you how to sell, though, and they don't teach you totally how to build a business.
Well, they teach you how to make presentations, that's right. For sure. I would say, though, on that subject, I think the danger because there's so much activity in this space, is you can think that you're being active by going to conferences, by participating in competitions, getting awards even, and moving along, when in fact you're not getting anywhere. You have to connect to the actual users, okay, not to the tech competition, et cetera. Because if you don't do that, you're going to wake up at the end of a year or two with your startup money, and you're going to wonder what happened.
Well, that's one of the things that impressed me most about eCaring over the last couple of years, is where everyone else was trying to make a lot of hype and a lot of fluff in this space, because there was a lot of media attention. You are actually out there getting customers and getting people using the technology and getting these data points out. So you actually were building a business first.
That's just the way I do it. There are certainly other ways, but I think you have to have a core business opportunity and then seize it. And I think that the key is to just make something work. You can make it work small scale, but then leverage that for getting more attention.
So being a digital media guy, where does education take place in eCaring? So we know that it's a great technology on the tablet, so I can say how I'm feeling and all that information. But is it two-way? Are you giving information back to the patient at all?
Certainly giving information back to the patient's care team. If the patient wants to participate in that, they can. Again, most of our clients, users, if you like, are Medicaid, Medicare recipients, various levels of cognitive capability. So I think for them, probably the important care goes with us training home aides in how to use the system, training, and we use a sort of train-the-trainer method of working with organizations, and then training the care managers. One thing about our system is it's completely customizable and configurable. So we can work with a given healthcare plan or payer and customize the information that's being generated by the general population, by condition or disease, or by individual. And you can do that for every data point we collect and for every alert that we generate. So you have this very fine-tuned system for garnering information and getting sort of longitudinal data over time that eCaring then can filter and give you best information on how to keep that person out of the hospital.
That's great, Robert. I'm Ben Chodor, and you're listening to Health Tech Talk, and with me is Robert Herzog, CEO of eCaring. So, Robert, my next question is, where are we going? So where's eCaring going? What are some of the things that you're working on that might come out over the next year without giving away too many secrets?
Well, we're building world-class technology partners to implement both in terms of tablets and connectivity and support services. Look, our goal is to be the ubiquitous source of home care data. You have major programs in New York State, such as FIDA, the Fully Integrated Dual Advantage Program, and DSRIP, and this and other states, Delivery Service Reform Incentive Payments. These are major programs that require your connected care universe in order to succeed. And so I see us as becoming a ubiquitous source of and format for home health care data that's then useful and integrated with other systems or whether they are automated data entry or they are health information networks in order to exchanges, in order to integrate this data into the everyday care of hopefully, frankly, millions of people. There are 5.5 million elderly dual eligibles in the United States. All told, they cost about $300 billion a year. I think we can have a real dent in that. So our vision is a big vision. It's not a niche vision.
Oh, and what's really cool is we all have parents. We all care about our parents. And if we can make their existence more healthier and at the same time save money and make a real difference, it's like really, really compelling. You know, so I applaud everything you're doing. So my next question to you, though, is in 5 years from now, when you sit down with me, what are we going to be talking about?
Dinner.
Yeah. Besides dinner.
Dinner and wine. I think if we are successful, we'll be talking about that we become a ubiquitous presence in the United States and even internationally. Remember, our system is icon-based, so it's inherently multilingual. So I believe we will be the standard. Frankly, what I would love to do is we, in effect, a lot of these homes, even though the infrastructure is there, don't have any internet in the home. So we provide that internet service. We're, in effect, subsidizing internet service through healthcare savings. And we can get the benefits of the internet, whether it's searching for a job or learning about your own benefits as a veteran or as an elderly person being able to order a meal or transportation. We can provide all those services in the home. So our vision, as I said, is to be, I'd love to get the federal FCC and the CMS in the same room at the same time and say, look, there are tens of millions of people who don't have this kind of service. We can provide that and save money in the process.
Robert, how do people find out about your organization, and how do, if my parents want to find out or any caregiver wants to find out?
Well, you go to www.ecaring.com or email us at info@ecaring.com. There's also a phone number on our website. So there are a lot of ways you can get to us, and we would be very happy to arrange demonstrations for organizations or even individuals and show them what we can do for them.
Robert, I want to thank you so much for being on the show. You were an incredible guest. eCaring is an amazing organization, and I am Ben Chodor, and you've been listening to Health Tech Talk on the iHeart Radio Network.